Question number 31. A 45-year-old man keeps having intrusive thoughts about having dirt under the bed. He can't keep himself from thinking about these thoughts. If he tries to resist, he starts having palpitations. What is the most likely diagnosis? Option A, OC personality. Option B, obsessive compulsive disorder or OCD. Option C, schizophrenia. Option D, panic disorder. Option E, phobia. So 45-year-old man has intrusive thoughts and he starts having palpitations. So the correct answer here is OCD or obsessive compulsive disorder. Question number 32. A 33-year-old man presents with an itchy scaly annular rash on his thigh after walk in the park. Which of the following drugs will treat his condition? Option A, erythromycin. Option B, doxycycline. Option C, penicillin. Option D, amoxicillin. So these all are antibiotics. So these all options are wrong. So we will use any antifungal drug for this condition. Okay, so correct answer is some antifungal drugs. Question number 33. A patient with cerebral mets has polyuria and polydipsia. What part of the brain would be affected? Option A, cerebral cortex. Option B, cerebellum. Option C, diencephalon. Option D, pons. Option E, medulla. So the correct option here is option C, diencephalon. Question number 34. A 32-year-old man presented with PLAB hematuria. He is hypertensive, but the rest of the exam is unremarkable. What is the most likely diagnosis? Option A, polycystic kidneys. Option B, cancer bladder. Option C, cancer prostate. Option D, TTP. Option E, HUS. So the correct option here is option B, cancer bladder. Question number 35. A 45-year-old female complains of pain in the inner side of her thigh. She was diagnosed with benign ovarian mass on the right. Which nerve is responsible for this pain? Option A, femoral nerve. Option B, obturator nerve. Option C, iliohypogastric nerve. Option D, ovarian branch of splanchnic nerve. Option E, pudendal nerve. So the correct option here is option B, obturator nerve. Question number 36. A 37-year-old lady strongly believes that a famous politician has been sending her flowers every day and in love with her. However, this is not the case. What is the most likely diagnosis? So the likely diagnosis here is option A, erotomania. It is the false belief. So the correct answer is option A, erotomania. Question number 37. A 3-year-old child has been brought with facial lacerations. On examination, he has some cuts over his right cheek and under the eye. The GCS is on the initial evaluation is 15. What is the most appropriate next investigation? Option A, skull XR. Option B, facial XR. Option C, CT scan. Option D, MRI. Option E, observation. So the 3-year-old child, his GCS is 15. So and he has facial laceration. So the correct option here is option E, observation. Question number 38. A 73-year-old woman has lymphadenopathy and splenomegaly. She feels well but has had recurrent chest infections. Recently, she chose the single most likely blood film findings. Option A, atypical lymphocytes. Option B, excess of mature lymphocytes. Option C, plasma cells. Option D, multiple immature granulocytes with blast cells. Option E, numerous blast cells. So the correct option here is option B, excess of mature lymphocytes. Question number 39. A lady presents with itching around the breast and greenish foul-smelling discharge from the nipple. She had a similar episode before. What is the most likely diagnosis? Option A, duct papilloma. Option B, duct ectasia. Option C, breast abscess. Option D, periductal mastitis. Option E, meriduct fistula. So the correct option here is option B, duct ectasia. Question number 40. A young male whose sclera was noted to be yellow by his colleagues has history of taking over-the-counter drugs for some pain. Tests show raised bilirubin, ALT and AST normal. The provocation test with IV nicotinic acid is positive and produces further rise in the serum bilirubin levels. What is the most likely diagnosis? Option A, acute hepatitis. Option B, drug hypersensitivity. Option C, Gilbert's syndrome. Option D, acute pancreatitis. So the correct option here is option C, Gilbert's syndrome. Question number 41. A 24-year-old biker has been rescued after being trapped under rocks for almost 12 hours. He complains of reddish brown urine. His creatinine is 350 mole per liter and his urea is 15 mole per liter. What is the most important step in the management of this patient? Option A, dialysis. Option B, IV normal saline. Option C, IV dextrose. So the correct option here is option B, IV normal saline. Question number 42. A 74-year-old man who has been smoker since he was 20 has recently been diagnosed with SCLC. What serum electrolyte picture will confirm the presence of SIADH? Option A, high serum sodium, low serum osmolarity, high urine osmolarity. Option B, low serum sodium, low serum osmolarity, high urine osmolarity. So the correct option is option B, low serum sodium, low serum osmolarity and high urine osmolarity. Question number 43. A man brought into the ED after being stabbed in the chest. Chest is bilaterally clear with muffled heart sounds. Blood pressure is 60 nil. Pulse is 120 beats per minute. JVP is raised. What is the most likely diagnosis? Option A, pulmonary embolism. Option B, cardiac tamponade. Option C, pericardial effusion. Option D, hemothorax. Option E, pneumothorax. So the correct option is option B, cardiac tamponade. So because muffled heart sound is characteristic feature of the cardiac tamponade. Question number 44. A 50-year-old patient is admitted for elective herniorrhaphy. Which of the following option will lead to a postponement of the operation? Option A, SBP 110 mmHg. Option B, MI 2 months ago. Option C, HEB 12 gram per deciliter. Option D, pain around hernia. Option E, abdominal distension. So the correct option here is option B, MI 2 months ago. Question number 45. A 32-year-old woman of 39 weeks gestation attends the antenatal age unit feeling very unwell with sudden onset of epigastric pain associated with nausea and vomiting. Her temperature is 36.7 degrees centigrade. Exam if she is found to have right upper quadrant tenderness. Her blood results show mild anemia, low platelets and elevated liver enzymes and hemolysis. What is the most likely diagnosis? Option A, acute fatty liver of pregnancy. Option B, acute pyelonephritis. Option C, cholecystitis. Option D, HELLP syndrome. Option E, acute hepatitis. So the presence of anemia, low platelets, elevated liver enzymes and hemolysis, these are characteristic features of HELLP syndrome. So the correct answer here is option D, HELLP syndrome. Question number 46. A woman comes with an ulcerated lesion 3 cm in the labia majorum. What is the lymphatic drainage of this area? Option A, external iliac. Option B, superficial inguinal lymph node. Option C, para-aortic. Option D, iliac. Option E, aortic. So the correct option here is option B, superficial inguinal lymph. Question number 47. A man post-cholecystectomy presented with jaundice, fever, dark urine. What is the most diagnostic investigation? Option A, ERCP. Option B, ultrasound abdomen. Option C, CT scan. Option D, MRCP. Option E, MRI. So the correct option here is option B, ultrasound abdomen. Question number 48. A 79-year-old stumbled and sustained a minor head injury 2 weeks ago. He has become increasingly confused, drowsy and unsteady. He has GCS of 13. He takes warfarin for atrial fibrillation. What is the most likely diagnosis? Option A, extradural hemorrhage. Option B, cerebral hemorrhage. Option C, epidural hemorrhage. Option D, subdural hemorrhage. Option E, subarachnoid hemorrhage. So the correct option is option D, subdural hemorrhage. Question number 49. A 25-year-old female complains of intermittent pain in her fingers. She describes episodes of numbness and burning of the fingers. She wears gloves whenever she leaves the house. What is the most probable diagnosis? Option A, Kawasaki disease. Option B, Takayasu arthritis. Option C, Buerger's disease. Option D, embolism. Option E, Raynaud's phenomena. So the correct option is option E, Raynaud's phenomena. Episodes of numbness and burning of fingers, These are characteristic features of Raynaud's phenomena. Question number 50. A 22-year-old lady has been unwell for some time. She came to the hospital with complaints of fever and painful vesicles in her left ear. What is the most probable diagnosis? Option A, acne. Option B, herpes zoster. Option C, chickenpox. Option D, insect bite. Option E, cellulitis. So the correct option here is option B, herpes zoster.